Welcome to this week topic, Endodontic Diagnostic. As a disclaimer, I should mention that this video is intended to make understandable some definitions and techniques that we use for endodontic diagnostic, but it's not intended to replace any type of formal reading. Being said that, let's start with the first thing that we should know. We should start defining what is endodontics. Endodontics is the part of the industry that deals with diagnosis and treatment of diseases of pulp and periapical tissues. So, what is the pulp? As a brief remember, we should remember that the tooth has the most external tissue, which is the enamel. Then we can find the dentin, and the most inner tissue will be the pulp. So endodontics will be taking care mainly of the pulp. As you can see, the pulp of the tooth will be comprehending the coronal part and the radicular part. In addition to that, we can find the root canal, which is the part that will be hosting the radicular pulp. In the pulp, we find nerves and blood vessels, which are going to provide the nutrition and the sensitivity to the tooth. How the progress of the pulpant and the periapical disease happens. So let's start here. In this picture, you can see two opposite sides. In one side, we have the vital pulp, which is like an intact in normal tooth. This pulp is healthy and is capable of healing after the irritant is removed. For example, if you all of a sudden want to eat an ice cream and you feel it very, very cold, but as soon as the ice cream disappears from your mouth, you are no longer going to feel that sensation of cold. In the other side, we have a non-vital pulp. A non-vital pulp it no longer responds to stimuli. It's considered necrotic and is unable to heal, which means that if you have a non-vital pulp, if you eat something very, very cold, most likely the tooth is not going to feel it because the tooth is basically dead. When you are dead, you're unable to feel anything. For that, I have this little guy here. And the vital pulp, you have a happy, strong tooth ready to fight any stimuli that will come to encounter him. And the other side, we have a dead tooth. He no longer can respond or feel anything because has already non-vital pulp. But my question here will be, what happened in between? What happened from this happy and vital pulp like this to become a dead and necrotic pulp? What happened in the middle? Well, what happened in the middle was that the tooth was fighting. The tooth was having a battle. In the middle of the battle was asking for help. So the first stage is the reversible pulpitis. The reversible pulpitis is when the pulp is inflamed, but is still able to heal when the irritant is removed. For example, when decay happens in a part of the tooth, if we take care of the decay, the tooth will be able to heal. That's why we place fillings in patients' tooth. But what happens if we don't take care of this decay? We are, still in enamel. We are, we don't have time to take care of the tooth. We don't have time to go to the dentist. We let the decay to progress, and decay will be moving down. And eventually it will reach dentin, and it will reach and get closer to the pulp. At this point, the pulp is going to start to feel it. And you see, it's going to start to become inflamed. The inflammation will make the tooth a little bit to increase the redness, the inflammation around the area of the tooth. And if this is not well taken care, it eventually will become an irreversible pulpitis. It results from a prolonged inflammation. This inflammation, we know we have the tooth that is bothering us whenever we eat very cold, we eat very hot. It's like a very, very sweet pain in the tooth, but it's not strong enough to bother us, so we don't take care of it. And then eventually, as a prolonged inflammation, it will become an irreversible pulpitis. At this point, the pulpal tissue is unable to heal. And the patient will come at the office saying, I am having very, very terrible toothache. I cannot eat anything. I wasn't able to sleep last night. I took Tylenol and it didn't work. I don't know what to do. Can you please check my teeth? So when patients say that, they are most likely in this stage where the tooth is fighting the last battle before it becomes necrotic. In the necrotic stage, the inflammation has invaded all the pulpal tissue and is, progressing and moving down to the roots. So when it moves to the roots, it's going to reach this area which we call the periapical area of the tooth. The periapical area of the tooth is gonna give, when it becomes infected, it's gonna result in a periapical process. So here, in the periapical diseases, at this point, the necrotic pulp is already present, and the inflammation and the disease has progressed down outside of the root. The first condition that can appear is the apical periodontitis. Apical because it's around the apex, and itis means inflammation. This inflammation can create two different conditions. First is the granuloma, which is the tumor filled with granulation tissue, or we can have the cysts. The cysts, they are fluid-filled or semi-solid filled. As you can see, the periapical periodontitis, it's an inflammation around the root of the tooth. The other condition that is a periapical condition is the periapical abscess. Peri means around, apical means the apex. So it's around the apex, we are encountering an abscess, which is the destruction of the tissue. The exudate is present. At this point, there are a lot of bacteria creating abscess around the tooth. And we will see an abscess trying to destroy the beautiful bone around the tooth. At this point, the pressure must be released. And we will see a little ball around the gums of the patient when when the pressure is released. How do we do the endodontic diagnosis? The endodontic diagnosis will comprehend the review of the medical and dental history. The review of the medical history is important because we need to know what the patient conditions are, any condition present like diabetes, hypertension, any type of systemic condition that the patient may have is important to review it. That's why we have the C that stands for conditions. Another important part of the medical history is the allergies. That's why I have an A here. Allergies, we should explore any allergies to latex, allergies to some medicines, or allergies to foods. And finally, the M will stand for medications. So these three things we are going to explore during the medical history. In the dental history, we will keep reviewing the history of the tooth, which we will develop in the next slide. In addition to that, we will do a clinical examination, which is usually performed by the dentist. And then we're gonna check the referring dentist notes. Sometimes we received a referral from a general dentist to an endodontic office. So it's important to see what the dentist has wrote in the notes before sending the patients to an endodontic treatment. The dental history. The dental history is the review of the past dental experiences. For example, we can ask the patient, did you ever have like a very excruciating pain? Or, when the pain started, what were, the circumstances of how long ago this pain started. And we also want to explore the current concerns. The current concerns, we're gonna let the patient to explain us and said we're gonna perform the subjective examination, which we are going to call like symptoms. Symptoms is everything that the patient feels, and it can be the type of pain. The type of pain can be sharpie, or lingering. We can ask about if the patient is having any thermal sensitivity, which means, are you having any sensitivity to cold, to hot, and the duration of the pain. The duration of the pain can be very, 3 seconds, 2 seconds, or it can stay there for a long time. This information will provide us important information to come up with the proper diagnostic. Now, the clinical examination. The clinical examination is going to evaluate the current concerns, but in this case, it's going to be an objective examination, which will be the signs. The signs is everything that you can see with your eyes. For example, when we see extraoral tissues, we see facial asymmetry. Do we see any swelling, any redness, any fistulas? Everything that you can see will be the signs, objective examination. Now, in the intraoral clinical examination, the tissues are evaluated and palpated in order to look for any caries, any discoloration, any fractures. But the clinical examination needs to have help of some type of auxiliary tests. For that, we're going to do clinical testing procedures. The first one that it's most, it's very important to have is radiographs. The radiographs are going to allow us to see inside the tooth beyond what we can just see with our eyes. Radiographies are going to let us know if there's any radiolucent area on the X-ray. It can indicate us that there is something going on beyond the tooth. For example, in this picture, you can see this radiolucency area around the tooth, which is telling us that there's a process. It's a process going on around the periapical area. And we also can see here another radiolucent area, which can be indicating us why this occurred. Another test that we can perform in order to get the proper diagnostic is palpation. We can use our fingers and explore the area around the tooth that we are evaluating. We can also do percussion. Percussion, as you can see in the picture, we can use the end part of the mirror, the handle of the mirror, and vertically, we want to tap in the tooth that is the patient is indicating. And actually, we're going to start not exactly where the patient indicates the pain is coming from. We are going to start one or two teeth before, so the patient can feel the difference between a healthy and unhealthy, tooth. In addition to this test, another auxiliary test that we can do is the test of mobility. For this purpose, we are going to handle two instruments, and very gentle, we are going to try to move side by side and see if there's any mobility in the tooth. The cold test, it provides very important information as well. It can be performed with dry eyes, ethyl chloride, and just eyes. And the heat test also can be performed to get us to the proper diagnostic. As you can see in these pictures, we have a cold test with eyes and a heat test with a heat gauge. We gotta be careful in this case that we don't burn the patient with the heat. So this is everything we have for today. And I'm gonna leave this question for you to answer below in the comments. What is the term used to refer an objective examination?